And good morning, everybody. Welcome to Marshall County Today. It's the talk show geared about talking of local stories, meeting local people and businesses around your neighborhood. Tony Ross, great to be with you. Today, we get to welcome in one of our favorite Mex family members, Woodlawn Health. And Krista, good morning. How are you, dear?
Good morning. I'm well. Thank you so much for having us. We're so excited to talk with you today.
And I'm going to let you do the honors to introduce this handsome gentleman off to my left here.
Oh, wow. I'm so excited to have Dr. Witt with us. Many people may know that he is a Plymouth boy. He's been here in Plymouth for several years now, and he's come to Woodlawn, and he does family practice along with doing OB as well, which, as we all know, in this area is a huge need. Yep. So, you can ask him a little bit more, but welcome, Dr. Witt.
Yeah, thank you. Thank you for having me this morning.
Good to see you, buddy.
Yeah, good to see you.
Let's kind of play off this Plymouth thing here. I had no idea you were a Plymouth resident.
Well, about 5 years ago is when my wife and I moved to town, so I call myself a transplant. So I trained up in Mishawaka, so we were a little bit north of here for the 4 years prior to that. Before that, Michigan. So we've kind of bounced around, throughout training, which takes a good amount of time. But originally grew up in southern Indiana. So still a Hoosier, born and raised, just moved to the north part of the state.
Wonderful.
So I like broad spectrum family medicine is where my passion is. So OB, all the way up to geriatrics and end of life care. That's the beauty of family medicine. You get to do a little bit of everything. But I obviously have a lot of passions outside of medicine as well. I'm an avid runner. And kind of dabble a lot in the marathon and ultramarathon scene, and married with 2 kids, so we're very much in toddler stage, so my life's pretty busy.
Yes, it sounds like it. Goodness gracious. I also was told that you actually kind of organized the Blueberry Stomp this year?
Yeah, my wife and I took over directorship of that 3 years ago.
Nice.
So when we moved to town, we knew it was going to be a long term. We wanted to plant roots. We're both passionate runners, and so the way to plant roots is to get involved, and that seemed like a natural fit for us since we're both runners. So we always seek partnerships with area organizations for sponsorships. Woodlawn Health was gracious enough to help sponsor this year. And this has been our biggest year for the Blueberry Stomp since we took over directorship, and hope to continue to grow it.
No, that's great news.
Yeah.
Great news. And you said you were here, you practiced here in Plymouth?
I did, yeah. I started practicing here in 2019, right before the pandemic, and then moved to Woodlawn Health pretty much a year ago to the day. I started there middle of September of 23. So
okay, so tell us a little bit more about your work in your field here a little bit. Since you've joined Woodlawn, talk a little bit about that.
Yeah, so, when people hear doctor, they can think a lot of different things. People can think just outpatient medicine. They can think the doctor that sees you when you're in the hospital. They can think of surgeons, their cardiologists. It's a very broad spectrum, a lot of different avenues you can go down. My specific area is, I'd say, 98% outpatient medicine, meaning when you're sick or when you need to go talk about your blood pressure medication or your diabetes medication. That's what I do. The 1% to 2% of inpatient stuff that I do is obstetrical care, OB care, delivering babies, seeing newborns in the hospital. So any outpatient routine stuff, acute illnesses, chronic disease management, that's really my bread and butter. That's where I spend most of my days, and very much enjoy navigating that with patients, because it's easy to get overwhelmed in the office space when someone's droning on about your health. People tend to glaze over a little bit and just look for the highlights at the end of the visit, which I enjoy doing. But then I'm also very passionate and enjoy the OB side of things, because it's just a whole different world.
I was just going to say, what's it like being part of your patients' lives when you're bringing in a new one? I mean, that's got to be so rewarding.
It is. It's exciting. It's rewarding. Because although, a lot of people can still name off their primary care doctors throughout their lives, it seems like women can always name the person that delivered their baby forever. Yeah. Even when they're 80, 90 year old, they can name who delivered their babies. So to be a part of that journey is special. I really enjoy multi moms, so moms that have had multiple babies before, but I really get a sense of enjoyment out of the first-time moms that have never been on that journey before. Everything is completely new to them. Everything is scary, and it's fun to navigate all that with them and put their mind at ease throughout the process.
How much has technology grown in this particular field?
Not as much as you would expect.
Really?
I mean, we've got some better monitoring capabilities. So outcomes are a lot better than they used to be 30, 40, 50 years ago. But it's still very much just monitoring how babies doing during the labor process and letting the moms do what the moms do.
A big proponent, I'm guessing here, prenatal care.
Absolutely.
And,
yeah.
And what does that look like now? I mean, what kind of suggestions you give to expecting mothers that to make sure you're working your way into a healthy delivery?
That's a great question. So the first thing I would say is if you are thinking about pregnancy or hoping to get pregnant, immediately start taking a prenatal vitamin just to first off make sure that you're getting a prenatal vitamin on a regular basis. Or if you were not expecting to get pregnant and find out that you're pregnant, start taking a prenatal vitamin right away. And then the moment that you get that first pregnancy test, contact who you would like to see for OB care. Starting at Woodlawn Health, we have, I believe, 4 delivering providers currently. And so reach out to Woodlawn Health and see who the options are to be able to see for your prenatal care, and let our office guide you through the process. Generally, we see patients for the first time in the office around 9 weeks, and then it's pretty much every 4 weeks after that until you're about halfway, a little bit past halfway through the pregnancy, and things ramp up from there.
I had knowing folks and families who are expecting or trying, who they trust to do this is huge. And,
Absolutely.
Tell me about yourself and understanding that, because I bring this up is because I've known a couple of people that didn't have very good experiences with their doctor with it, and because they felt that something was missing, something was off, and unfortunately, the deliveries of the 2 people that I know were kind of rough.
Yeah.
And so, I mean, what I don't know. I guess I'm asking you a question that's, kind of tough to magic 8 ball here, but
no, I know where you're heading. It's a great question. Any sort of medical care you receive is a deeply personal experience, but especially so when it's related to a pregnancy and your unborn child. So there is a deep level of faith that you need to be able to have in the provider that you see. And it's a little bit of a leap of faith, because oftentimes you're seeing that provider for the first time for your first prenatal visit and have never met that person before,
right,
unless they were your previous primary care provider. Shout out to family medicine that does it all. So I would say a lot of people will choose their provider based off of who their friends have seen, what they read online, right? They do their research before they just randomly show up in a doctor's office. But I'd say all the providers within Woodlawn Health practice very similarly. We want to make sure that the patient feels safe in her pregnancy, feels cared for, is well supported, and so there's not a wrong choice in my mind with any of the providers that we have on staff. But it is something that you need to be comfortable with who you choose, and know that just because you have a couple visits doesn't mean if things are starting to feel uncomfortable for you that you can't seek care with a different provider. You don't want to feel tied down and a prisoner through the pregnancy. You need to feel safe where you're at.
So, I mean, you practice here in Plymouth, and then you decided to go to Woodlawn. What sparked that particular transition for you?
I really liked Woodlawn's message about earning the right to care for you. It is not it's not a right, it's a privilege that we have to be able to care for our patients. And they have earned that. And I love that it is a small town hospital, and everyone that makes the decisions at that hospital live in that community. And that spoke volumes to me and why I decided to make the move. And,
you probably understood or were realizing that, this hospital, man, is making some serious strides in from the technology standpoint to just simple, caring of the patients. Did you get that feeling too when you went in and started talking to some folks saying, hey, I'm interested in coming here?
Absolutely. It's fun to be a part of an organization that is growing and expanding and adding services and interested in adding service lines in the future. Just since being there for a year, we've already added podiatry services. And, you know, the other thing that I really love about Woodlawn is that they very much are receptive to feedback from the providers in the community. And if we say, hey, we really need this, there's not this 50 person chain of command that has to be run in order to get something changed. They immediately say, you know what, that does sound like a reasonable thing. Let's look into it. Let's dive into it and see if it's a possibility. So change can happen a lot faster in smaller systems, and I've definitely seen that in the last year.
So you also take care of other things.
Absolutely. Yeah.
So talk a little bit about that real quick.
Yeah, so as I mentioned...
Maybe a little more detail.
Yeah, as I mentioned, I very much love the OB piece, but even with a busy OB practice, it's still just a small portion, really, of what I do. I spend most of my time with chronic disease management, wellness, preventative care. You know, obviously, as a family medicine provider, I'm very heavy on the preventative care, which can sometimes be a hard sell for people that are naive to the medical community, right? People don't love going to the doctor. I get that.
Dang, you just busted me.
Everybody gets that. But the reason we talk about those preventative services when you come in is because the evidence shows that it saves lives to stay on top of those preventative services, getting your screening colonoscopy, getting your screening mammogram, staying up on your cervical cancer screening. Early detection is key for cure for a lot of those disease processes. So that's why those screening services are in place, and that's the stuff that we really harp on when you come in for your wellness visits.
You mentioned chronic care. Can you give us some examples of what chronic care is?
Yeah, so high blood pressure management, high cholesterol management, diabetes management, thyroid disease, list goes on and on. Those are what I would call more the bread butter, COPD, asthma management. All of those chronic disease that you are taking your daily medicines for, that is the stuff that I do out of the office. We like to try and as quickly as possible get to what I call cruising level, so where we're not making a whole lot of tweaks to your regimen on a yearly basis. That's kind of where we need you to be. But getting to that point, ramping up medicines as appropriate if needed, is what I do on a day in, day out basis.
So do you get any sleep?
I do, yes.
Okay. All right, that's good.
I have a very good staff that allow me to work efficiently through the day. So I have very little work in the evenings when I get home, which is important as a dad of two young toddlers. So yeah, it can be a very busy life. It can be a very hectic life, but it's extremely rewarding to be a part of those very intimate conversations with patients. That's really where I feel. That's where I feel at home, is in the exam room, one-on-one with a patient, having those discussions, because I was trained to do that. That's what I spend every day doing. So I'm always eager and willing to dive into those conversations that the patients don't want to talk about with anybody else for obvious reasons. Yeah.
I find a doctor of your caliber that we need more, truth be told, because it just seems there's something new always popping up that's would fit or fall under the chronic disease department that you handle. Are we seeing shortages of doctors, do you think?
Absolutely, yeah. There's more and more recruitment to the bigger cities, and younger physicians are more attracted to the bigger cities, which is just a self-perpetuating issue, right? Because as people grow up in the bigger cities, that's what they know, so they want to then return to the bigger cities. And so these rural communities are seeing generation after generation less and less providers going into those small communities. Thankfully, I grew up in a town even smaller than Plymouth, so this is the size, and Rochester is the size of community that I wanted to live in and practice in when I was from a young age, and so I'm glad that I've been able to live that out to this point. But we're absolutely in a severe physician shortage, and unfortunately not a great end in sight. Residency program slots are not really growing, so that is a bit of the bottleneck of creating new physicians. And we're seeing a lot of retirement from older physicians and physicians that are moving, like I said, to larger cities. So the rural communities are really the areas that suffer the most. But we've got a very great network down in Fulton County and here in Marshall County where we're growing to take care of those patients.
So in other words, thank God we got physicians like you. That's,
Sure. Your words, not mine.
That's right. And again, I don't know how you're doing it, Krista, but you're finding so many wonderful physicians that believe in the, small town, taking care of people, seeing people, wanting to see people, and that's a tough thing. And this is why you guys are right now, you're full stride and growing.
We're running full steam. We started running in about 2023, full steam, and becoming really the community's health system.
Yeah.
Dr. Witt said it so well, and I know every time I come here, I say it over and over again. We live here, we work here, we have kids here. This community, making sure a health system thrives so our community can thrive, is near and dear to all of us. That's something that I feel like we all feel in our hearts. And if you don't feel that, then maybe we're not a good fit for you, and that's okay. Healthcare has many facets that you can find your place, but here in our area, we want to make sure that we're making decisions that benefit everyone. Dr. Sanders says it really well. Now, I might mess up this quote, but she says, we can't take care of everyone, but everyone we can take care of, we do well. And so I really feel that's what we want to do. But
you take care of one big factor, and that's trust. Mm-hmm. And I mean, that is huge. If patients who got issues, if they don't feel it, they're not going to trust decisions that you guys help and try to system in. You guys take care of that immediately as soon as the patient walks through the doors. And I at least know 10 or more that you guys have treated. That's why I say you're growing and you're catching a lot of attention on the services you guys are providing. And again, that's not easy. Yeah, it's not easy at all. And for people who may be listening that may not be here in Plymouth, but talk about your offices elsewhere.
Mm-hmm. Yes, so we're really blessed not only to have offices in Rochester, but we also have offices in Argus and Akron as well. So that gives us the opportunity to bring healthcare to the community. I always like to paint a picture of what happens if we didn't have rural healthcare, right? It's a national statistic that across the board, places are having to close in rural communities for lack of resources or providers. But what that really means is that people can't get to the doctor. And when they can't get to the doctor, chronic disease goes out the window or goes up substantially. And then you also have the need of that. They're seeking care only when they're super sick and they're having to drive an hour. And so when we have offices in rural locations like Akron and Argus as well, in rural locations, it allows those ladies who maybe are in their 80s or 90s who don't want to drive, 30 minutes or can't drive the 30 minutes. Right. It allows them to be able to get that care that they need on a routine basis. And that allows for the management of chronic diseases or just maybe little things that pop up to be cared for. Preventative care is way easier and way less expensive if caught early. And so that's what we are able to do a lot of.
Again, looking at a crystal ball in the future, and Doc will go with you on this one, where do you see family medicine going? Is it going to stay the pace that it's at now, or do we need to really start fighting for our local health care here to make sure doctors are taking care of one, getting paid what they deserve, but I mean actually without being overloaded? Because there's a lot of X factors, and it's kind of a loaded question to be honest with you, but for assurance purpose is what I'm asking. Is the family medicine practice going to be? Does it have the ability to sustain itself right now? Because we're talking here about shortages of physicians, which is just making you even more important. But man, you're only human too. You can only take care of so much and so many people without it affecting your personal life and your family.
Yeah.
So if it's not necessarily a positive, how can we turn around and make it a positive?
That's the $1 million question, right? Is what's our future of healthcare going to look like? It's very easy to look around and start to paint a very grim picture of the future of medical care with the shortage of family physicians, with difficulty to access your providers, the closing of OB units in small communities around the state, around the country. It's very easy to start to go down this very depressing rabbit hole of how are we going to fix all this. But it all goes back to hospital organizations like Woodlawn Health that are willing to put in the time and the money to invest in the local communities to keep those very necessary services present in our rural areas. So yes, I do think it's sustainable because we have organizations like Woodlawn that are willing to put in the effort, but we need...
Well, that's a key word right there, isn't it?
Absolutely.
The effort.
It takes not only money, but it takes the full effort of administration and providers and staff in those offices that often feel overworked because of the amount of patients we're having to care for on a daily basis. It is truly a full team effort to care for these communities, but it's a labor of love for all of us because, as Krista said, our families are in these communities, our kids are in these communities. We want our kids to come back to these communities. We want younger families to be comfortable moving to these communities. And in order for all that to happen, we have to have a medical presence here, because if there's no medical presence, families can't live here. They're going to have to go where they can get medical care.
Right.
So I do think that we're going to continue to expand and grow our services. I know that we are actively recruiting and trying to gain even more of a foothold with new providers. So I look for exciting things with my crystal ball for the future.
But, I want to just say one thing. If you want to keep healthcare in rural communities, we need the community to use us. The way that we make and are able to sustain operations is by services being utilized. So I know sometimes it's easy to say, and I grew up in a small town, so I'm totally guilty of this. We want to go to the bigger place because it might look more flashy or they might have more services. But the truth is we can do a lot here. And when you utilize services here, you help keep healthcare here. Because if we have no one to serve, then we get no revenue in. And no revenue in means we don't get great doctors like Dr. Witt. So.
Right.
What you said about we can do a lot of things here is funny that you say that, because at least a couple times a week I'll have patients that are surprised about things that they can get done at Woodlawn Hospital and that they don't have to drive to South Bend for, or to go over to Fort Wayne for, or go down to Indianapolis for. No, we don't have every specialist available to us because we are a small hospital system in a rural town, but we can provide a lot of services that a lot of patients aren't aware of.
Yeah, absolutely. All right. So, Doc, how does people get a hold of you for your services?
So I am at Fulton County Medical Clinic, which is located right next to the hospital in downtown Rochester. And my phone number, I do not have memorized off the top of my head. But you can certainly go. You can certainly go on woodlawnhealth.org, and then my phone number for the office at Fulton County Medical Clinic is 574-223-4337. I am accepting all new patients and newborns and OB patients as well. So that's always a good place to start.
Well, folks, here in Marshall County, you're hearing it firsthand. I mean, we've got an OB presence now, and it's called Woodlawn Health, and be part of it. And the Fulton County Medical Clinic is where you can see this wonderful gentleman, and he'll take care of you. Once again, you just don't disappoint every time you come in here, Krista. You guys, you're just great. I mean, honestly, and we need to have a local presence with our healthcare. I don't care what anybody says, and it's about that trust. And you're getting it every time people are walking through those doors. And that's pretty impressive. So thank you for being in Marshall County. And if any other questions, just call Woodlawn and go from there. And that's, there's really nothing else. You guys keep it simple to begin with, which is, for guys like me, it's needed. So yeah, thank you guys for coming in. Dr. Witt, what a pleasure it is to meet you, and we look forward to having you on down the road.
Absolutely. I appreciate it. Thanks for having me on this morning.
Thank you, Krista.
Yeah, thanks so much for having us. We always love coming.
Well, we appreciate you. All right, so we got to get out of here, and we'll be back to wrap up the show in a moment.